Hi, my name is Gerd Singleton and I was a part of the pharmacy group that helped evaluate patient MA today. Ms. MA came into the clinic for a routine checkup but had a chief complaint of heartburn that she experiences 5 to 6 times a week and has been going on for the past 4 months. Ms. MA is a 58-year-old female who has a history of COPD, hypertension, and hypothyroidism. Her mother died at 73 of a stroke and father died at 77 of lung cancer. She smokes a half pack a day and drinks occasionally, mostly on the weekends and mostly wine. She owns a diner where she eats most of her meals that mostly consist of pasta with some type of tomato sauce, and she drinks 3 to 4 cups of coffee a day, with her last cup of coffee usually being sometime in the afternoon. On today's visit, we did collect labs from Miss MA. Everything appeared within normal limits except she had an elevated blood pressure of 153/96. She had high total cholesterol, high LDL, borderline triglycerides, low HDL, high TSH, and low T4. She also had a creatinine clearance of 85.36 milliliters per minute. We also saw an adenopathy and thyromegaly in her neck and lymph nodes. Her current medications include hydrochlorothiazide 50 milligrams, one by mouth every morning, a baby aspirin every day, 75 micrograms of levothyroxine every morning, Advair 250 over 50 milligrams, one inhalation twice a day, tiotropium 18 micrograms, one inhalation once a day, albuterol as needed, but she does indicate that she's been using her rescue inhaler more than she used to. She takes Aleve as needed, but she indicates she takes it 2 to 3 times a week for her back and knee pain. She takes Tums as needed, but lately she's been taking it with every meal because of her increased heartburn symptoms, and she takes a daily multivitamin. After evaluation today, we do believe that Ms. MA is experiencing GERD. Our goals of therapy for this is to decrease the amount and severity of her heartburn episodes while increasing her quality of life. This can be accomplished through different lifestyle modifications as well as prescription medications. For her hypothyroidism, we want to increase her T4 levels to at least greater than 4.5 while decreasing her TSH levels to less than 4.7. For her hypertension, we want to decrease her blood pressure to less than 130/80 millimeters of mercury. For her COPD, we want to stabilize her FEV1 and FVC values while decreasing the amount of time she has to use her rescue inhaler, which subsequently decreases the amount of time she experiences shortness of breath and wheezing episodes. For her hyperlipidemia, we want to decrease her total cholesterol to less than 200, decrease her LDL to less than 100, decrease her triglycerides to less than 150, and increase her HDL or good cholesterol to greater than 50. For Miss MA's GERD, we do recommend Dexlant capsules. This is something that she can take without having to worry about separating from her levothyroxine, but it is something that can give her 24 hours of relief of her heartburn and GERD symptoms. We recommend taking this in the morning with her levothyroxine, but we do recommend spacing out her levothyroxine from her daily multivitamin, which she should take with her evening meals. So hopefully that will help her hypothyroidism. If not, then we do recommend an increase in her levothyroxine dose. For her hypertension, we recommend incorporation of lisinopril 20 milligrams. This comes in a combination tablet with hydrochlorothiazide, so she doesn't have to worry about taking multiple tablets at multiple times of the day. For her COPD, we recommend smoking cessation first and foremost. We did provide her with some information on different programs for smoking cessation. We also counseled her on the importance of adherence of both of her inhalers and taking them at the right time of the day and in the right fashion. For her hyperlipidemia, we do recommend simvastatin 10 milligrams and reevaluation within 3 months for her cholesterol levels to see if the simvastatin is decreasing her total cholesterol and LDL and triglycerides. We do want to see her back in 2 weeks to reevaluate her GERD to see if her heartburn severity and symptoms have decreased. If you have any questions, please give us a call. Thank you.